Hi, my name is Dr. Rudra Mohan, and through the Oral Health channel, today we're going to be talking about laser assisted root planing procedure in non-surgical periodontal therapy. Let's start. So today's episode is very close to my heart because this is something that I do very often with my periodontitis patients. I've already talked about periodontitis and what a pocket is. That means what is a periodontal pocket. Basically, it's the gum disease which starts off in your gingival sulcus. That is the gap between your gums and the teeth. That is about 1 to 3 mm, which is the normal depth of the gingival sulcus in health, and that is self-cleansable with the help of a toothbrush. Now, what happens because of the fact that there is plaque accumulation, the sulcus becomes deeper, it becomes more inflamed, there is more ulceration, maybe pain-like symptoms as well, and it forms into a pocket. Now, the pocket depth can vary depending upon the disease severity and the chronicity, and that's where you start having and developing periodontitis. Once this infection reaches the bone and the bone starts to wither away and get dissolved because of disease, that's when basically the periodontitis starts to manifest itself in its complete full-blown force and glory. And if it goes uncorrected, it can lead to loss of teeth because of the fact that the teeth become loose. Now, when we talk about the periodontal therapy at a glance, usually it starts off with non-surgical periodontal therapy that includes scaling and root planing. Root planing is a procedure where you help the pockets to get back to their original state of health with the help of mechanical debridement. That means you use specialized instruments known as curettes, and then you plane the root surfaces to help in taking out all the periodontal microflora and the biofilm by disrupting it. Now, once you do this and then we have a follow-up of the maintenance therapy, we realize that most of the pockets can go down. However, in some cases where the bone loss is very severe and the amount of pocket is the depth is huge, you might have to go for surgical entry for access and then see it under direct vision and then clean out and debride, if at all requiring bone grafts for replacing the lost bone. Now, periodontal patients especially are very, they have periodontitis in the first place because of lack of motivation. And once they get to know that they've already had periodontitis in its full-blown fury, what happens is they get to know that they have to go for the non-surgical therapy, and then they have to go for the surgical therapy, which is the going under the knife and opening the gums and doing the flap surgery. What you have to really understand is that a lot of patients are very afraid of the blade. They're very afraid of the anesthesia. They're afraid of the fact that there is post-op recession in surgeries. I am not saying that you should not go for surgeries where it is required. Definitely, absolutely, I'm an ardent supporter of surgery, and you have to understand that where it is required, it should be done, no matter what you feel about it. If it's required, that means it's required. If you require to do bone graft and regenerative therapy, then you get it done. Now, with the advent of lasers, they can be really used as adjuncts to non-surgical therapy, where it helps in elimination and reduction of pocket depths with the lasers. And because of the fact that they have an microbial effect, they have a hemostatic effect, they have a bactericidal effect, and they have an anti-inflammatory effect also. I'm not going to go into the details. The procedure is very simple. This is done as a part of the non-surgical periodontal therapy, and the diode lasers that I use, at least in my clinic, has preset settings where we can use it for different procedures such as pocket sterilizations, gingivectomies, even LANAP. Now, LANAP is a procedure that I will definitely talk about in the next few episodes, which is a very beautiful procedure for helping in reduction of pocket depths. So the procedure is very simple. While we have done the mechanical debridement with the help of root planing and using curettes, we lase the tooth surface by placing the tip in the continuous mode, from right to left around 6 points around the tooth, and that's where the magic happens. Not only you can do it under topical local anesthesia, however, I would strongly recommend, if your patient has a low pain threshold, definitely go for injectable anesthesia. But I have done this in my patients in topical anesthesia. That means no needles, just give them a topical LA, and basically you're good to go with the lasing effect. The results have been fantastic, and I personally speak from my personal experiences. My patients have had a lot of good feedback for me regarding that. And also you have to understand that the data also supports that there is good reduction in pocket therapy. Most importantly, the two things that patients are really thankful about when they get the lasing done is they feel that their pockets have become tight. That's very important. The gums have become tighter, they've become taut, and there is less bleeding now. So that bleeding is because the less bleeding is because of the hemostatic effect of the lasers. And also, let me give you again a statutory warning that wherever the surgeries are required, you have to go for the surgery. However, we can reduce the number of surgical sites with the help of lasing and root planing, because we can get the periodontal status of a few sites which have moderate bone loss or pocket depths are moderate to slightly severe. We can really reduce them back to the state of health, and that's where you can reduce the surgery, the surgical field. On top of that, the biggest advantage that lasing has as an adjunct to SRP, that is scaling and root planing, is that once you go for a full mouth flap surgery, it takes about 6 to 8 weeks, because you have to do it quadrant wise. So you split the mouth into 4 quadrants, 8, 8, 8, 8. So 8 into 4 is 32. And you have to give at least 2 weeks time for each surgery to happen. So that's about a good 6 to 8 weeks for the whole procedure, right from day 0, the baseline day, to the last surgery. So that's a lot of time. However, with lasing and SRP, you can do it in one appointment, and that too within 1.5 hours if you know the craft. And that's where the patients get really hooked onto it, because of the fact that it is a smaller procedure, it is less painless, you might not require anesthesia, there's less post-operative sensitivity, there's less post-operative recession, and the feel of the gums after the surgery is very good compared to after the lasing, is very good compared to the surgery. So what you really need to understand is that despite the fact that laser is an adjunct, I would strongly recommend, if you have the means in terms of logistics and financials to get rid of your pyorrhea or periodontitis, you can definitely try out this option of using lasers as an adjunct to periodontal therapy, and you can also get it done as a part of your maintenance therapy. So this was today's episode. Please like, share, subscribe, and do press the bell icon button for important updates. If you want to get in touch with me, here are my social media handles. Kindly refrain from calling me directly, as I might be busy with patients. Just drop me a WhatsApp, voice note, or maybe a message with your name, the location, and the current oral health problem that's causing you discomfort. And please be patient with me, because I get a lot of calls, I get a lot of messages, and I might not be able to respond immediately, stat on that day. So make sure that you have some patience, and I will get back to you even if it's after 2-3 days. Just be a little patient with me, because you are my spectators, my audiences are the ones that help me grow as a person, as a clinician, and I'm completely indebted to you guys, because of the fact that I get to learn so much. In the past 3 years, because of YouTube, I don't think I've learned so much in order to help you people, the audiences. So I am really, really humbled, and I'm completely, grateful to you guys. So please be a little patient with me when I'm trying to, respond to your messages. And if you have any queries, doubts, apprehensions, suggestions, or any sort of, comments, please put them in the YouTube comment section. So that's it for today. Thank you.